As we reported in our last hour, the scales are tipping in the right direction in the fight against childhood obesity. Obesity rates dropping 43% among 2 to 5-year-olds in the past decade. That, according to 2012 data from the Centers for Disease Control and Prevention. Obesity rates in the bulk of the population, however, remain essentially unchanged. So here with a look at what could be behind the trend, Dr. Devi Nampiaparampil, Assistant Professor of Anesthesiology and Rehabilitation at NYU's School of Medicine. So the good news is, among the kids, 2 to 5-year-olds, 43% drop. I guess I would take it as bad news that nobody seems to know why.
Well, you could think about it that way. I mean, it's good news that the numbers came down, but there's still 8% obesity in that age group. So you wonder why, especially for that age. You know, parents or other adults are buying them their food, so it's not like they're subject to so much advertising. And in terms of physical activity, I mean, regular play is what they need. They don't really need to get a gym membership or other things. So it's a little bit concerning that the obesity rate is even that high.
And that it's unchanged among adults.
Exactly. So that's very concerning. And the percentage is about 35%. That means that for adults, 1 in 3 are considered obese. For youths, that percentage is about 17%. So again, those numbers aren't changing, but you wonder why they're at that level. I mean, over the past decade, there's been a lot of changes. I mean, in terms of diet, now we hear about caloric content in a lot of foods. We get a lot more information about nutrition. We have a lot more fitness crazes as well. Like if you think about all the Fitbits and other trackers, if you think about how much people are getting into yoga and other wellness activities, you wonder why that number doesn't come down significantly.
Yeah. So the kids, these numbers are coming from the Centers for Disease Control, and it's a pretty solid number, I guess. I mean, it's not something that came from a dodgy research group, but you have some questions about the methodology of the research.
Well, I wonder, a lot of this is based on growth charts. Now, these growth charts have been accepted for years, decades, but at the same time, they're based on data that we had in the past. So they are based on data about people who, from a time when malnutrition and undernutrition were the biggest concerns. So they're based on height and weight. Now, what we care about isn't so much height and weight in terms of appearance, but we really care about fitness or how long somebody's going to live. So maybe those growth charts need to be looked at a little bit more. I mean, even the composition of our country, the way that people look, people's ethnicities, a lot of things, the genetic pool, a lot of those things have changed over time. So even though the growth charts may be the best thing that we have right now, maybe they need to be looked at a little bit further to show, what's really reflective of our society.
And there are a lot of grandparents out there who think that a healthy baby is a chubby baby.
Yeah, exactly. Well, even amongst grandparents, I mean, the obesity rates are going up in that group as well. So especially women over age 60, you wonder about that. I mean, some of that may be hormonal changes like menopause, but some of it may be because we have a population that's living longer. So if you're living longer, you're more likely to have chronic conditions, maybe heart disease or arthritis, that prevent you from exercising as well. So,
Dr. Devi, thanks for coming in to talk to us about it.
It's always good to see you.
Thank you. Jenna.